And what are the top three, or the most common mistakes that you see as a consultant in this area of biocomp and biological evaluations and characterization?
Okay, so I think thinking mainly about the biggest mistakes in the extractables and leachables type testing, probably the biggest mistake, and I would put an element of blame on this on the test houses, laboratories, is manufacturers thinking and being led to believe that extractables and leachables testing will now be the answer to everything. What we're seeing increasingly is a requirement from notified bodies, or the expectation from notified bodies, to include extractables and leachables, but it's not the answer to everything. It's just a contributory part of the overall biological evaluation. I think the next biggest mistake, once you get into the detail of extractables and leachables testing, is not setting an appropriate analytical evaluation threshold. And this needs to be set really as a discussion between the manufacturer, the analytical laboratory, and the toxicologist to make sure it's an appropriate value. And then that hopefully avoids some problems later when evaluating the data. And then once all the data have been evaluated, I think probably one of the next big issues is manufacturers panicking when the toxicologist can't demonstrate an adequate margin of safety for a chemical which has been identified in an extractable study. And I think this is kind of a lack of understanding of the difference between extractables and leachables. So extractables is very much a very worst case scenario. So it's not unexpected that you will see an unrealistic amount of chemical detected in an extractable study, and you then may need to do a more targeted approach with a leachable study to understand the clinical relevance of that value.
So Phil, we're seeing quite a lot of interest from sort of university spin-outs and startups, and I suppose they're early on in their development cycle and of a device. What would be your advice for them and top tips for starting out biological evaluations and biocomp and chemical characterization?
Well, we work quite closely with a number of spin-outs, university departments that are in this kind of position. And I think the key thing is probably more so for these small businesses and spin-outs rather than the big manufacturers, is to engage early with their supplier, their laboratories, their consultants, and to understand what's going to be required. The other thing is to make sure that they are aligned with their regulatory strategy. So one of the first questions I ask of these spin-out companies is, what's your regulatory strategy? At which point I usually get a stunned silence. And then I say, who's your regulatory consultant? And then I have to recommend that they get a regulatory consultant. Because it's important that all these bits are lined up. Consistent strategy. And I think the other thing that's important, although engaging with consultants, whether it's for regulatory strategy or for extractables and leachables, biocompatibility testing elements, and engage with those people as early as possible, but also make sure that you firm up on what your final device is going to be. And this comes back to the earlier question about what should I test? What you want to avoid, as all possible, is testing a sample which then changes and you need to retest.